Parietal bones. Lucent study notes. Parietal bones. A pair of flat bones forming the roof and sides of the calvaria, skull vault. They protect the brain and contribute to skull shape. 1. Articulations and sutures. Sagittal suture. Joint between the right and left parietal bones in the midline. Fibrous joint connecting paired parietals. Coronal suture. Articulation between parietal bones and frontal bone anteriorly. Separates frontal bone from parietals. Bregma. Point where coronal and sagittal sutures meet. Important craniometric landmark. Bregmatic fontanelle, anterior fontanelle. Soft membranous area present at bregma in infants. Allows skull growth and aids childbirth. Lambdoidal suture. Posterior articulation between parietal bones and occipital bone. Has a beveled concave surface on parietals, useful in identification. Squamous margin. Lateral border articulating with the temporal bones. Thin, overlapping margin. 2. External surface features. Temporal lines. Ridges extending from the frontal bone onto the parietals. Mark areas of temporalis muscle attachment. Sagittal elevation. Slight ridge along sagittal suture. Usually poorly developed in modern humans. Parietal foramina. Small openings near the posterior midline. Transmit emissary veins to the superior sagittal sinus. Non-metric trait. May be present or absent on one or both sides. Enlarged foramina. May indicate hereditary traits. Parietal eminences, right and left. Rounded prominences on the posterolateral surface. May vary in presence and size among individuals. 3. Internal endocranial surface. Grooves for middle meningeal arteries. Irregular depressions on the inner surface. Caused by arterial branches supplying the meninges. Direction of arterial grooves. Run upward and backward. Helps in sighting the bone. 4. Sighting of parietal bone. Hold the bone in anatomical position and observe. Convex surface right pointing arrow outer surface. Arterial grooves pointing superior and posterior right pointing arrow correct orientation. Useful for identifying fragmentary skeletal remains. 5. Inferior posterior feature. Transverse sulcus. Linear depression near the infero-posterior angle. Associated with venous sinus impressions. Subscribe Medical World.